When you get to the hospital, head to the specialist rehab, which has its own entrance just to the left of the main hospital entrance. Once inside, head to reception where one of the team will check you in. You will then be taken to our dedicated waiting area, and one of the Gait lab team will come and collect you from here at your allocated appointment time. We'll then take you down the corridor to our Gait lab. Our lab is inside a large room, and we have a technologist based in the lab who will also be present during your appointment. We will ask you to take a seat at the bottom end of the lab where we'll have a chat about your referral, ask for additional relevant information and explain a bit more about what will be going on during your appointment. We will then ask you, or your parents if under the age of 16, to sign a consent form and then ask you to change into your shorts. All of our patients have a clinical examination where we test for muscle length, strength and any abnormal tone. The clinician will move the legs whilst the technologist takes some measurements and photographs. This takes a little while to complete and gives you a chance to relax before we move on to walking. After the clinical examination, we will ask you to walk up and down the lab along the dark blue line whilst our cameras record your walk from different angles. We may ask you to do this a few times, barefoot, with shoes, and also with any splints that you might wear. This enables us to compare your walking under different conditions. But don't worry, you can have plenty of rest breaks if needed, and we will never ask you to do more than you can manage. After the video, we may undertake a number of different assessments. This could include 3D motion analysis, which involves sticking reflective markers to your lower legs to measure your joint ranges as you move. You will then do a bit more walking up and down the blue line, 4 to 5 times ideally. At the same time, we may stick extra sensors onto the legs to measure muscle activity whilst walking. We may ask you to walk over a pressure pad in the lab, which we'll pull out onto the walkway, and ask you to walk over this a number of times until we have collected 5 to 6 clean images of each foot. This enables us to look at the shape of the footprint and any unusual areas of pressure. We also have heel wedges and splints in the lab, which we can try out with you if we think they may help your walking, prior to referring you to orthotics if we think this might be relevant. We allocate a 2-hour appointment slot for all of our gait analysis patients, but on average you can expect to be with us for about 1 to 1.5 hours, depending on which tests we feel are needed during your appointment. We hope this video helps you to feel prepared for your upcoming appointment with us, and we look forward to seeing you soon.